per year for the period beginning July 1, 2024 through June 30th, 2029 for public health emergency preparedness. 1B, authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement for public health emergency preparedness grant for the period beginning July 1, 2024 through June 30th, 2029. And just want to recognize for the record, Councilperson Dewan Wiggins did join at 7:10. Deanna?
Thank you so much, Chairperson Eris. So we have been receiving grant funding to support our public health emergency preparedness efforts for many years. We used to get the funding directly from the Connecticut Department of Public Health, but they've since created a more regional approach. And so for our region, Stratford is the lead, and they contract with Ledgelight Health District to serve as a fiduciary. So that's why it's grant funding from Ledgelight, which is like in the eastern part of the state, just to clarify that. But this is funding that we use to support our part-time emergency preparedness coordinator and our part-time emergency response team coordinator. As you know, we have several volunteers that were instrumental in our COVID response. And so it's two part-time people and hundreds of volunteers that are in this division of the health department. And again, I always say I can't thank them enough for all that they do. But this is funding for the next 5 years to continue to support those efforts. You're on mute again.
You saw me just talking. Thank you for the information. Are there any questions from any of my colleagues? Okay, hearing and seeing no hands being raised, we're going to take this information as if we're going to take your presentation as information and move this to the full council. Then we have a 2A and 2B that reads as follows. Authorize the mayor, Harry W. Railing, to enter into an agreement with Flourish and Thrive Labs, LLC, in an amount not to exceed $15,000 from grant amount number noted for HIPAA consultation service. 2B, authorize the mayor, Harry W. Railing, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Flourish and Thrive Labs, LLC, for HIPAA consultation services. Is that you again, Deanna? Deanna?
It is. Thank you, Chairperson Ayers.
You're welcome.
So this is part of an improvement initiative, and it's also in line with our strategic plan. One of our strategic priorities is technology, and one component of that is security and confidentiality. So as you know, HIPAA is a federal regulation. There's many different components to it, and we're looking to better enhance our ability to comply with the complicated federal regulations. But the first step of that is we want to establish ourselves as a hybrid entity. So because we bill insurances electronically, we fall under the HIPAA umbrella. But as we establish ourselves as a hybrid entity, it allows us to separate the covered functions under HIPAA and the non-covered functions so that we can separate them. And that involves an assessment and a written policy. And as you know, HIPAA is very complicated. And so we want to utilize and work with consultants to help us through this process, also in partnership, of course, with the law department. So we met with about 5 different companies, got quotes, and we're really excited about the potential to work with Flourish and Thrive, which is very public health focused. They understand local health departments, which, as you know, are different than your traditional healthcare facilities. So we're hoping to move forward with this project. Thank you.
Thank you. Director Dearmore, can you just, for my own curiosity, when you're saying hybrid, is this now going to make us more efficient? Is this now going to allow us to offer different or more services? Can you just elaborate on that just a little?
It'll allow us to focus on the areas that will need to comply with all the HIPAA requirements. So it will definitely create more efficiencies to be able to separate those that will fall under, traditional public health confidentiality statutes and rules. And it'll also it'll lower the risk for the city as well from a financial standpoint.
Wonderful. Any questions from my colleagues? Okay, we will also move this to full council.
Thank you so much.
You're welcome. Have a good one. Next is Human Services. I see Miss Mary Oster already on, ready to talk. Number one, authorize the mayor, Harry W. Railing, to execute any and all documents necessary to extend the agreements by which the city subgrants the child daycare contract grant funds it receives from the State of Connecticut Office of Early Childhood for the state fiscal year 2025 with the following child care providers: Odyssey Learning Inc., Trinity CDC Inc., Stepping Stones Museum for Children Inc., Connecticut Institute for Communities Inc., and Growing C2 Child Development Center. Ms. Oster?
Hi, good evening, everybody. Thanks, Chairperson Ayers. So this is a grant that the city has been getting for approximately 20 years. Funds childcare spots for preschoolers and toddlers in our city using community providers that were just named. And the grant amount is about $1.874 million. This is for this coming fiscal year. The council already approved for the mayor to sign the grant from the state. So we've done that, but now we need to be able to pay the subcontractors, which were listed. And so this will allow the mayor to sign those contracts with those subcontractors for the coming year.
Thank you. Do any of my colleagues have any questions? Okay, thank you, Ms. Oster. We will move this to the full council.
Thanks so much. I appreciate it.
You're welcome.
Bye.
Number two, authorize the mayor, Harry W. Railing, to execute any and all documents or amendments as may be necessary to disperse the community impact mini grant program funding to support smaller nonprofit allocated to the community service department in the amount of $100,000. Account number noted. Chief Daniels?
Yes, Chair, you must have the old agenda item that was removed.
It sure was. I do apologize. Strike that. So then we're going back up to you to authorize for
Correct.
NAWA partnership. Okay. Thank you for the correction. Authorize the mayor, Harry W. Railing, to execute any and all documents or amendments as may be necessary to disperse the non-competitive I can't talk. That word. Procurement.
Yep.
Procurement. I got it. Funding to the NAWA partnership to support the development and execution of the community youth mental health gap analyzed in the amount of 15,000. Positive directions. The Center for Prevention and Counseling is the fiduciary for TMP. Account noted. Chief Daniels?
Yes, thank you. And I know that we're not approving, but I definitely wanted to share. And you all have the supporting documents, but this request came to us about 2 weeks ago, and I'm requesting your support for the approval of the non-competitive procurement request in an amount of $15,000. So for the purpose of this request, I'm asking your approval to authorize the mayor to go into contract. You all know I get excited over a lot of things, and this adds to it. This $15,000 will fund a comprehensive youth mental health gap analysis for the city of Norwalk. As noted, the project will be conducted by the Norwalk Partnership. Positive Directions is their fiduciary. And I think we all know Norwalk Partnership, they oversee the citywide youth mental health survey, and they are the local designated mental health substance abuse designated board here in the city of Norwalk. We all know that mental health is a cornerstone of our overall well-being, especially for our youth. We all heard many stories of the impact of COVID-19 that has impacted our youth. both in school and out of school. Unfortunately, what we do know is that there are significant gaps in mental health services available to young people. As you all know, through this committee and through the council approval, we've asked for additional dollars to increase capacity to some of our local nonprofits to serve our youth both in school and in the community. And our first round of ARPA dollars was dedicated to increasing capacity for mental health services. But there are gaps, and these gaps are essential to ensuring that all youth have access to the care and support they need. So what is this project going to do? Number one, it's going to outline the current state of services so we can really understand the mental health service available to youth in Norwalk. And you've heard me say there's a lot of resources, but we don't have a comprehensive studied research document so we can really understand what actually is available to youth, who is being served, who is not being served, so we can really get a handle on the capacity and what's happening in our community. We're part of this request that I'm asking is that the researcher is going to actually map the funding sources. As I pointed out, the city, we stepped up to the plate, and the city of Norwalk should be very proud that when the call of duty happened, we provided funding to increase capacity for mental health services. And then also, this particular analysis is going to look at models of what's happening in these services, and then also explore funding applications. And so why this request is so important? Well, through this non-competitive procurement, Chair Ayers, procurement, that's like a tongue twister. I have engaged in a really special collaboration, and I just wanted to note it for the record, although you have it in your documents. This collaboration is with Silver Hair Hospital, who is eager to expand and show up in Norwalk and help our young people. The Norwalk Community Health Center, who provide mental health services, which is one of our federally qualified community health centers in the city of Norwalk. And then Norwalk Acts, they are the collective impact arm that works in our city. And then, of course, the Norwalk Public Schools. This is a group that I've met with, and they're all on board, and they all will be supporting and helping in a lot of ways and providing the strategic direction in how this mental health gap analysis will be implemented. And so I'm asking for your support for this request, because this request enables us to take a significant step toward improving mental health services for the youth of Norwalk. And I also want to note this investment, though is minimal, but in comparison to potential benefits, we will have a profound impact on our community. This document will be the boilerplate for us, the city, our partners, to seek funding to increase services. And so I'm really excited, ask for your support for this allocation to work with Norwalk, to work with the partnership. They're already on board. They have a consultant that I am extremely excited about, who I know can get the job done, is well respected in our community. And so again, asking for this committee's support and your support through the council process to allocate this funding so we can get a better handle on what the needs are, the gaps are, but then most importantly, this document will be used to seek additional funding. Thank you.
Thank you, Chief. I think this is very, very exciting. We often look at the allocations that we get to different things, and it's sometimes not able to track the success. And I think this will be giving us a little bit, this will give us the ability to track to see how well we are doing in this mental health fight with our young people. So I'm excited for this. Any of my other colleagues? Barbara, I see your hand.
Yes, thank you, Chair Ayers. Yeah, it is very exciting. I have a question about how will Silver Hills be involved? And, you know, will they be providing services for our kids? Will that happen, you know, here in Norwalk, or would the kids need to go to Silver Hills? I'd just like to hear more about how that would work.
Yeah, so I don't want to get ahead of myself. So Silver Hill is a partner in helping us think about this.
Okay.
Silver Hill is a partner in helping us create the you know, how the research is going to be done. But I can also feel confident to say that they are very interested to be a partner long term in our city.
Okay. In the city. Okay. All right. That's something, you know, I'm curious about, because, you know, the mental health need for kids has been so profound, even before the pandemic, but of course, since the pandemic, and there have not been enough programs, you know, like a day type program where, I don't know. I just, you know, I've been through a lot of this personally, from my own children. And I just know it's, you know, it's very hard to find a day program for young people who are struggling, but not in an extreme way, right? Some of the day programs, you know, are really focused on, you know, people who are really, really, really struggling, right? And so kids who are just, you know, just trying to manage or have some depression or anxiety or whatever, that might not be the right place for them. And so, you know, we want our kids to feel safe and secure in the right type of program for them. So I'm really, really excited to hear that, you know, they're looking to service our kids here.
Thank you. If I could just add to that, because I want to be clear, because I don't want to go ahead, because nothing is public in this sense for the purpose of this. But you know, they are an institution, and they're at the present time for this particular request, they're a thought partner.
Got it.
Can they potentially be a provider over time? Yes, but that's why this document and this research, it'll be so critical, Barbara, to your point, that it's going to help us understand, hey, we're good here, but we need more of this. Or we're okay here, but we need to increase capacity. And to, you know, to Chair Ayers' point, you know, when you seek funding, we know anecdotally what we need, but most funders or all funders, whether it's at the federal level, the state level, or our philanthropic partners, you know, they want to see a well thought document to really quantify and qualify. We did our research. We did our homework. We know what we need because we invested, and that's where I take pride. The city of Norwalk government said this matters to us, and so we're going to put an investment in this gap analysis and encourage the partners and the providers. Now you have a document to use to leverage and say, let's get the resources here in our city, because this document would tell us what's working, what's not working, where we fall short at, and now we can have those discussions with our funding partners to really identify the resources that's so needed in our community.
Okay, understood. That clarifies everything for me. Thank you so much.
Okay, thank you.
Okay, any other questions? All right, we will also move that to full council. Is there a motion to adjourn?
Motion to adjourn.
Thank you. Motion to adjourn. Everyone have a good night. Be safe.
All right. Good night.
Night, night.
Well,